Obesity is another area that we constantly work with as dietitians. We need to make sure that we are out in the public educating on the risk factors for obesity, what that can lead to if it's not controlled. If you guys remember during class, the PowerPoint said people who are overweight puts them at risk for what? And you saw multiple chronic diseases listed. Um, just to name a few as a refresher, we have heart disease, we have cancer, we have gallbladder disease, ulcers, pancreatic complications, whether that's pancreatitis or whether that's pancreatic cancer. All of these areas, patients are at a higher risk for when they're overweight. I had shared that little tidbit of information. For every 1 pound that somebody is overweight, that's 4 pounds on their joints. So a lot of people who are obese or morbidly obese end up having to have knee replacement surgery, hip replacement surgery, because our joints were not designed to carry that much extra weight. It's really important that with adults, we start to educate about the energy in, energy out. Adults tend to get fixated on their work. They're sitting at a computer all day and then they come home and they're tired. They just sit on the couch. Maybe they have some children that they have to get ready, so it's not a lot of time to prioritize to work out. So then we continue to eat our normal portion sizes, but we're not burning off as many calories, and this is what's going to increase that risk of obesity. Especially for females, once we have those hormonal changes, it's really hard for us to fight off that extra weight. We talked about if the weight is carried in our bellies, it is an increased risk because that fat is closer to our heart, so then we can have a heart attack much easier. Versus if we carry our weight in our hips, it's bad, but it's not quite as dangerous as when we carry it in that abdominal section. With obesity, we need to teach them how to change lifestyle behaviors. When we say, hey, you can't have Twinkies or Oreos anymore, we need to fill that void. So we need to encourage clients to find other ways of coping with maybe stress or coping with their feelings of sadness or depression. We also need to remember that in the back of our head that genetics does play a role, and it can be very frustrating for a client who has tried multiple times losing weight. We also want to encourage them that a slow weight loss actually means that they're going to keep the weight off longer. So we don't want to be losing 10 pounds a week. The healthy weight loss is 1 to 2 pounds per week. So that's about 4 pounds a month. We don't put this weight on overnight. We don't put on 10 pounds in 1 week. So it's important that we tell these clients it's going to be a slow process and not to give up. We don't want them to go to those fad diets, the weight loss surgery. We really want to encourage them to take their time to lose that weight because they're less likely to gain that weight back if they lose it 1 to 2 pounds per week. This can be very frustrating for the client, but it's something that's sustainable, and in time they will see results and it will be more beneficial for them. So we need to continue to encourage them that it's okay, it's a slow process, it's not going to happen overnight, and we're here to help them, whether that's providing them recipes, menus, a support system. If they want to call you or text you about a new recipe, we are their friend. We are here to help them and encourage them. It's one of the most rewarding things as a dietitian when you're counseling a patient and they come back and they say, I lost 10 pounds the past 6 months because of working with you. That is incredible. They've shown even just losing 5% of your body weight significantly lowers your risk for heart disease, cancer, etc. So it's really important that we remember that obesity is not just diet related, but rather it's a lifestyle. There's other components such as genetics that we need to be mindful of, and we need to let our clients know that and be very transparent with them. But one of the best ways is just to have them focus on healthy eating, getting physical activity, and being mindful about their approach to this lifestyle change.